Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then there is a question: if a patient is a hypertensive patient and he is an elderly, hypertensive plus elderly, and the patient has a history of aspirin intake. Hypertensive patient, elderly with history of aspirin intake, and if he complains of black stools. So what is it due to? See, whenever a hypotensive patient with elderly patient with history of aspirin intake, black stools. See, what is the diagnosis? See, whenever there is black stools, that means there is a hemorrhage which is going on. Second, aspirin intake. Intake of aspirin states that aspirin is actually an antiplatelet. So this patient, the platelet aggregation is less, so as a result there is increased risk of bleeding is seen in these patients. And obviously he is an elderly, so there is bleeding is occurring. So this is actually a case of drug induced gastritis. This is actually a case of drug induced gastritis. Okay, because of this drug like aspirin, there is gastritis resulting in bleeding. Then if, but why is it not due to peptic ulcer? Right, if the same question is given, same question, this is the same question, but instead of aspirin, if there is an history of NSAID intake, if it is a NSAID intake instead of aspirin, then it will be a peptic ulcer disease, because NSAIDs are not does not cause bleeding, right? NSAIDs will actually, if it is given as NSAIDs, in such cases NSAIDs are actually prostaglandin inhibitors. So these will decrease the mucus production in the gastric ulcer, in the stomach. Because they decrease the mucus production in the stomach, this will predispose to bleeding peptic ulcers. So this is the main question.
thank you and thank you for watching.